Hi, Dr. Mamun.
Hi, how are you? Eugene, nice to see you again. I'm Dr. Nishad Mamun. I'm currently a resident in physical medicine and rehabilitation at Memorial Regional South Hospital. I'm completing my residency there, and in about a year, I'll actually be starting my pain fellowship in MD Anderson, Houston, Texas, where I'll learn how to do interventional pain techniques and such. And then hopefully thereafter, I start a private pain practice after that to manage pain in various patients. So very excited about that. You and I first met last year when I was treating your son in my clinic, and we've kept in touch ever since. Thank you for taking the time to meet with me. I'm very interested in learning about healthcare finance and revenue cycle, and I was hoping that you would share some information um, about that from your vast experience. I do have several questions for you.
Great. Well, it's a pleasure to meet you again, and I'll gladly share any knowledge that I have. So go ahead.
Awesome. Awesome. Can you go over your background a little bit?
Sure. I started off getting a degree in corporate finance from USC. Afterwards, spent 6 years in corporate finance with Clark's company and the Walt Disney Company. And then for the past 16 years, I've been in healthcare on the finance side, with 14 of them being in a CFO role. So I spent 11 years in total with the federally qualified health center in Los Angeles, and then the past 5 years with a physician-based group that staffs emergency room, hospitalist, intensivist, and anesthesia providers to hospitals. About 3.5 years ago, we launched a medical billing company. So I handle medical billing and finance.
Great. What can you recommend for someone who is setting up or operating a medical practice?
Sure. I definitely would urge you to plan well. Start by putting together a business plan. Get somebody who has done business plans to help you out. Work on getting proper funding because you'll need it, whether it's equipment, whether it's building out office space, whether it's ramp up period. And then I would spend a lot of time researching the market. I would call all competing practices in the neighborhood, and I would find out when is the next available appointment. If it's a month or two out, then you know that there's some unmet need, and and you should do fine. But if practices have availability within a week, then there's too much capacity, and you know you'll have more competition, so you might want to look at a different neighborhood. Then I would focus on getting quality staff from front desk to office manager, and so on. Figure out your marketing plan and also figure out your insurance contracting options. All of those are very important. You don't want to open up an office and sit there without patients. You want to make sure that you're contracted and you have either referral sources or some kind of marketing engine. On the finance side, I would also recommend that you look into positive pay. This would prevent any unauthorized withdrawals from your accounts. It would also stop any kind of fraudulent checks. We have seen that over the years. Review bank activity for any unrecognized transactions. That does happen these days. And then if your staff is paying bills, then definitely I would recommend to make sure that any authorization to pay bills does not take place via emails. Emails are easy to hack, and we have seen some cases of hackers looking in, monitoring accounts, and then sending out fraudulent guidance.
Yeah, that's certainly scary. Great. Besides the finance experience, you mentioned medical billing. How did you get into that part of business?
Sure. As a CFO of community clinic with many jobs on the line, I had to get involved with medical billing because that was our main source of revenue. And in order to have enough revenue to cover payroll and other bills, need to make sure that the revenues are coming in steady without any hiccups and produce great collection rates. So I created a number of different reports. I would monitor those reports and performance to make sure that we don't have problems, or if we do find problems, so that we can resolve them. And then at the physician-based group, When I came in, we started off with 5 different billing companies. And then over the past couple of years, we brought all of those accounts in-house into a new medical billing company.
Wow. For medical practices, what is very important to know to maximize revenue and not to leave any money on the table?
Okay. I would suggest that you confirm that coding is done properly. So there are a number of sources you can use. There are a number of coding associations, message boards. You can find various professionals that will help for whatever specialty is, or billing companies could help. You want to make sure that you're utilizing all appropriate codes. And then I would suggest that you do not sign every contract from insurance plans that comes your way. Because if you do that, you're going to get taken advantage by IPAs and insurance plans. You're going to be working for them, not for yourself. Upfront staff, I would urge to properly verify insurance to make sure that you don't have claims going to the wrong place and then you have untimely filing. So verifying insurance is important. And then focus on denial management and follow-ups. Some claims will not get paid, some claims will get denied. So you want to make sure that your billers have a proper process in place.
And what are some of the pitfalls in medical billing, would you say?
Missing charts, not billing for all billable visits. I have seen data transfer issues, payment posting issues, denial issues, backlogs due to staffing shortages. We have seen a little bit of all.
Can you provide some examples of what may have gone wrong before?
Sure. So I'm associated with a business on a financial side. I'm not billing for them. It's a residential treatment center. And there's another billing company that bills and they provide some additional services to them. And what we have seen as we've been handling accounting and financial management, we started monitoring billing reports and comparing against what's coming in at the bank and talking to the operator and trying to get this business streamlined. One of the things that we noticed that something was not adding up in terms of what we were hearing from the operator versus what we were seeing in the billing data. So we created census reports based on the billing data, and we compared against what the facility actually did. Now, facility was not creating census reports. Instead, they provided access into their EMR to the billing company, and billing company was billing for those patients. Now, for us to compare to make sure that we billed everybody, we had to create census with bed by bed and names of the patients for which days they occupied. So we asked the practice to implement that. Once that got implemented, we started comparing against billing data, and we noticed that over a period of 3 months, there were 20 plus patient bed days that were missing, that were never billed. And on average, these are about $700 a visit stays. So this was a pretty material issue, and now we have a good process in place. And then on the payment posting side, we also had an issue with the same company where there was a new payer that they signed contract with, and there have been some patients, and the billing report showed that there have been patients from the new payer, but bank did not reflect that. So there was a mismatch between banking info and the billing info. And what ended up happening was the payer would pay with what's known as virtual cards. So they would mail a paper, it looks like a credit card is in there, and you run that virtual card as if it was a credit card. And the facility took that document and forwarded to the billing company. The billing company assumed that facility charged it and just logged in the payment on their side. And in reality, this facility did not have a merchant account at all because they never received payments from patients, they never received virtual cards. So we caught this error. It was a little over $19,000 that was recorded as payment, but there was no evidence of payment being made. So we implemented additional controls on reconciliation between payments going out, coming in versus what's being posted on the medical billing side. So those are just some examples. And in both cases, this facility, we were able to recoup over $40,000.
What do you recommend that all medical practices do to ensure successful revenue cycle function?
So they have to build a good team, whether it's internal or external. There are a lot of billing companies out there. There are a lot of billing departments. There's clear evidence that some are good and some are not good. So definitely need to focus and find the right people to handle billing. I would definitely recommend getting second opinion on coding. You don't need to do it often, but you can download your data. You can do a distribution of your codes, and you can check against several other agencies to see whether your doctors are coding correctly and whether you should be having some additional codes in this type of field. And then the other piece, I would make sure that the reports that you're getting are very, very useful, not just reports that don't tell you enough about what's going on.
Right. And what would a good report look like?
So majority of the billing companies, some billing companies don't provide a report. Some billing companies provide a single page. They provide an invoice and saying, here's, we collected 70,000, here's what you owe us. Some provide a report saying, here's what we collected by biller. So those are really, really bad. You want to make sure what's been billed. You have a number of charts that have been billed, collections listed. And the main key that I learned is most billing companies, they'll provide reports based on activity date or date of process. And what happens when you look at those reports, you end up seeing what the billing company did during that month. So during that month, they could have billed claims for prior month. They could have billed some claims for month earlier. Collections that are posted in there, these collections are applicable to prior periods. So these reports are not really good. They're basically telling you that the billing company has been working. That's it. The only useful thing out of those reports is it tells you exactly what's been collected and you can verify against what you have in the bank. Now, what I prefer to use is reports based on date of service. So these are reports, same type of data, but we have going month by month, and it would help me see that if we go back to, let's say, January, and I want to see, and it's been 10 months out, I want to see what kind of collection rates did we achieve? How much did we collect on average for visits that took place during January? Did we reach 90, 95, 97% collection rate? If we haven't, I want to make sure that I understand why. Okay, so that's extremely important. I haven't seen any that provide by date of service. That's why we created those internally. But I'm pretty sure under a little bit of pressure, those reports could be generated. Okay, and definitely know your collection rates. If you're contracted, you can quantify collection rates, dollars collected versus dollars you were supposed to collect. And if you're not contracted, then my recommendation would be you take total number of visits, charts that have been billed, and how many of those have been paid. And I would look at those reports, not just summary for the month, but I would look at it what's known as a payer mix or plan mix, look at plan by plan, month by month, so you could see what are the collection rates and what kind of issues is your billing company or your outsourced billing company is having.
This is great information, Eugene. Thank you very much for taking the time. If any of my followers and if any of your followers or whoever's watching this video has any other questions, where could they reach you?
Sure. The easiest would be they can give me a call. My number is 310-422-9480. I'll be glad to chat with them. And then alternatively, I can be found on LinkedIn under Eugene Veksler, V like Victor, E like Edward, K like King, S like Sam, L like Larry, E like Edward, R like Robert Veksler. Thank you, doctor, and glad to help. Let me know if you have any other questions in the future.
Awesome. Thank you.
Okay. Thank you.